Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Vrishya Karma and we have seen the three important considerations for this karma. The first one is Shukra Vruddhi Kara aspect, in which Shukra Saman Dravya are very useful. Second is Shukra Sudhikara, which will enhance or help in the proper ejaculation. And third, which is equally important or more important in clinical practice, is Shukra Stambandha. It means to prevent the early ejaculation. Now, all these three factors are in direct perspective of Shukra Dhatu as such. But when we are discussing Vrishya Karma, there are some other considerations which are equally important, which are not directly, indirectly useful or required for Vrishya Karma. The first, and which is commonly required in clinical practice, is the strength of the muscles of the penile area. Patient often complain that there is no stiffness because of shaithilya or lethargy of the musculature. Hence, in Vrishya Karma, we have to consider the dravyas which will give strength to the muscles, which will give a proper erection and proper stiffness. Now, in this case, you have to consider the Mamsa Dhatu as a muscular area, and so the dravyas which will act and give strength to the Mamsa Dhatu are required. Now, the second aspect of this muscular strength is the proper blood supply, because when there is a proper oxygenation to the cells of the muscles, the strength of the muscles will be enhanced automatically. So, two things which are indirectly required for Vrishya Karma other than Shukra Dhatu is one Mamsa Dhatu, and secondly proper supply of blood or Rakta Pravaha in that area. So, in that case, for Mamsa Dhatu you can use Ashwagandha, Yashti Madhu, Bala like Dravya. For a good proper supply of the blood, you can use Chitra etc. Dravya, which will increase the blood supply in that area. So, when we are discussing Vrishya Karma as such, Shukra Sutrikara, Shukra Vardha, Shukra Stambhan, and giving Mamsa strength or Mamsa Dhatu and Rakta Dhatu both also come into the action. The another factor which is very important in today's practice is Manasik Sthiti or temperament. Because of stressful life, because of worries, stress, there is a direct effect on the Vrishya Karma of the patient, and hence when you are going to take the case, you will inquire about the physical conditions and you will rectify that, but also go in deep and search whether there is any psychological factor affecting the patient's mind, and also the Vrishya Karma is getting hampered. There is another common condition as far as this muscular strength is considered, especially in the young people, that excessive of masturbation is one of the cause which after some time makes that muscle weak, and after the continuous this masturbation, patient then complains that I don't have a proper stiffness. Nowadays there are so many misconceptions about this masturbation etc., and because of the open era of knowledge, people make their own some concepts, misbeliefs, and hence when a young people come to you with this complaint, always check the history of masturbation, and if it is so, you have to consult or counsel the patient and you have to advise that to keep away from this all process. Always remember, when a couple comes to you, you have to search that whether they are compatible, not only physical level but at the mental level. Misunderstandings or difference of opinion also leads to the impairment of the Vrishya karma. Hence, in Vrishya karma, you have to consider not only Shukra Dhatu but Rakta Dhatu, Mansa Dhatu, and Manasa Sthiti, which is going to affect this karma. Now, when a patient comes to you that there is some problem with the Vrishya karma, we have talked about the Vrishya or Shukra Dhatu, or the process of the proper erection and ejaculation, etc. But when a person comes specific for the infertility cause, that everything is right, but there is some problem with the conception and some spermatic deformity, you have to consider the sperm as a special entity and you have to focus it on that particular element. When we are discussing the diseases of Shukravasrotas, I am going to pinpoint the deformity of sperms and their clinical application in detail. So, for up to today, in general, we have seen Vrishya the factors to be considered, and their management clinically. Thank you very much. Please subscribe the channel, please forward to your friends, and also give comments or any queries or topics you want to discuss in the comments. We will meet in the next episode with some new topic. Thank you very much.